When it comes to mental health, sometimes it can be overwhelming, especially when you think about the illnesses, because it's hard to tell the difference from one illness to the next. That's exactly what we're talking about with our coastal expert from Horizon Behavioral Health. Joining me now is Dr. Hamilton Perisol, who is a psychotherapist here at Horizon. Thanks so much for joining us, Dr. Perisol.
Sure, Natalie.
So what I want to talk with you about today, I've read a lot about, and even I get confused. I want to know the difference between bipolar type 1 and bipolar type 2. I mean, sometimes referred as bipolar depression.
Sure. Well, the interesting thing is that bipolar type 1 or type 2 have very similar symptoms. It's just a question of the intensity, frequency, or duration of those symptoms. And the best way sometimes to describe it is better to use a picture. Because I can list a bunch of symptoms and it can get kind of confusing.
Right.
So I have some caricatures from literature, if I may.
Yes.
One of them is Tigger. All right.
Tigger.
Tigger.
Like we're all familiar with Tigger from
Yeah,
Disney.
Exactly. And the other one is Eeyore. All right.
Eeyore.
Yeah.
Now these are some of my favorite characters.
Sure. Now Tigger, for example, bounces off the wall. He has so much of a spring in his step, he springs from his tail, all right? So
right.
For a bipolar condition, you're going to have those types of symptoms where people sometimes feel like they're bouncing off the wall, whether it's type 1 or type 2. But coupled with that is Eeyore, because he'll sometimes be so depressed that even when he's happy, he's sad. When he says, "Oh, joy."
He seems so down,
yes.
even when he is supposed to be happy.
Exactly. So for bipolar, just imagine this character trying to negotiate between being 1 like Tigger or 2 like Eeyore.
Wow.
And they can't necessarily navigate their way through that. So for type 1, you're going to have more of Tigger. And for type 2, there's going to be more Eeyore. Exactly.
So what should a person do if they think they or a loved one might be experiencing some of the symptoms that we're talking about here today?
Well, first of all, I think it's important to recognize that it's very treatable. It sometimes takes persistence to get the right kind of help. First and foremost, be sure to get in to see a professional and ask them straight up, are they familiar with treating bipolar? And get to the heart of it. The quicker you get into treatment, the quicker the chances of stabilizing this condition. And the point is that it's going to be persistent until you do get help, but it's manageable.
The bipolar disorders, type 1 and type 2, are they always treated with medications?
Yes, they are. Supplements help. There's a great number of supplements that will help. But in the long run, medication, thankfully, has progressed a great deal. And it helps with the neurotransmitters to better regulate. Medication alone is probably not the best solution. Talk therapy combined with medication is the best because we all need to make a connection with somebody.
What would you say to individuals out there right now? Maybe they're sitting there thinking, oh, I need to pick up the phone and maybe give them a call. But they're a little scared to make that call. What would you say to that person?
I would say stop worrying about it and do something about it. Because if you don't do it now, it'll catch up with you later. And the neat thing is that there is treatment available. It's very effective as long as you get with the right clinicians and make sure that you have medication management coupled with psychotherapy along the way. In addition to that, I would include family and friends. Don't be ashamed of any condition, whether it's bipolar or what it is. The idea is that you can get through this if you get the right help.
And of course, if you want to get the right help, make sure that you go to the website or pick up the phone and call the number, the experts here at Horizon Behavioral Health. Dr. Perisol, I want to thank you for joining us today and providing me with all the information that you did. It's always great to see you.
You too.
It's great to see you.
All right.
If you'd like more information on Horizon Behavioral Health, or any of our coastal experts, just go to our Coastal Experts page. You'll find that at wsav.com.